Hello and welcome to this episode of Body Garage. We are glad to have you join us this day as we delve into drug abuse and drug addiction, one that has been a pressing health concern globally and of course here in Kenya. And to help us shed more light on this topic, we have Dr. Pauline. Thank you for joining us. How are you today?
Fine, thank you. Welcome. Thank you for the show.
All right. Yeah. Also, we do have the company of some youth in studio. Karibuni sana, mnafilaje? Mko poa? Yeah. All right, Dr. Pauline, let's start with the ones and twos. First, what is drugs? What are drugs? What are the categories of drugs? And what is drug addiction?
So when it comes to drugs, we know drugs are chemical substances that help to prevent, diagnose, and treat diseases and also abnormal behavior. But when we come to drugs of addiction, we are looking at drugs that affect, cause changes in how we feel, our thoughts, and even behavior. So when it comes to addiction, drug addiction or alcohol, because we combine the two, is a chronic relapsing disease characterized by compulsive use and also use and control despite the adverse consequences that are caused by the drugs. There's this urge to continue using and despite the health problems that we can be able to experience after we use.
Okay, so are there any categories for instance, now these drugs that do get, addicted to them? Are there categories of these drugs?
Yes, we basically can categorize them into two. We have the depressants, where we have the alcohol, cocaine, and then we have the opioids also, which fall under the depressants. Then we have the stimulants, where we have bang, we have cat, which is mira. That's where we can categorize them as depressants and stimulants because of the effect they cause on the central nervous system and the physiological response. And their drug of action, so to say. Yes.
So when you talk about their drugs of action, and so my question would then be, what are some of the short-term effects when you use a certain drug? For instance, let's say cat. What are some of the short-term risks of, indulging in this drug?
So when it comes to the most commonly drugs that I would also say is that has been categorized in Kenya, we are looking at statistics according to NACADA in 2022. Alcohol is the leading with about 11.8%. Then we have tobacco, which is 8.5%. We have cat, which is mira, at 3.6%, cannabis at 1.9%, prescription drugs, over-the-counter medication, we know there's a lot of it going on, 0.2%, polysubstance, where people are using more than one drug, is about 6.5%, and also now what we call at least one drug of substance is about 17.5% of the users. This category of users is between 15 years of age to about 65 years of age. So when we talk about substance and drug of abuse, we have short-term and long-term effects. So you had asked about
what are some of the short-term?
Let's say for alcohol, of course, you feel a bit high, then it becomes a depressant. When it comes to, then there's also what we call loss of consciousness for some people. Those are adverse effects if you overdose. There's instability in terms of your gait. You're not able to walk well. Thought process is altered. You're not able to think clearly and even make hasty decisions. And that's why we advise, you can even cause accidents. That's why we advise when you take alcohol not to drive. Because those are some of the short effects. Long-term effects will occur, let's say neurological effects and physiological effects. That one now goes to what we're talking about, health issues. So maybe we'll clarify that
as we go on. You did give us some numbers, probably now for the ages of 18 to about 35.
Right.
What is the most abused drug for that particular age group?
It's still alcohol. It's still the leading, even at that age.
Do we have cases of now, what, 10 to about 18? Do we have cases of, the most abused drug for that age group?
Yeah, it's still the same. I think this was general, according to what they said. So I think it's still the same. Still, alcohol is still the leading.
Alcohol is
still the leading. Yes.
And with us in studio, we do have, students and youth who are of the ages 18 to about 35. They say alcohol is the most leading. Probably, in your perspective, what are the factors that lead some of the youth to actually indulge in alcohol intake? Let's have the lady in red. What do you think?
My name is Gloria. Actually, I can say depression or stress. Yeah.
And stress.
Yeah.
Do you think that social media has played a part in terms of making, drugs look like the thing you're missing out on? Anyone else who wants to give it a go?
I'll say maybe peer pressure can lead to drug abuse.
To drug abuse,
yeah,
yes.
Maybe your friends, can have many friends that are using drugs. Maybe I'll say like that.
And Pauline, you hear, right, it's almost peer pressure. So then someone now has used these drugs. What are some of the signs that, I am actually now becoming addicted? What are some of the signs? Because at first it's just about trying it out. You're curious to know, what does it feel like? What will I feel like when I take this particular drug? So then at what point do I know now I'm seriously getting addicted?
As we are saying that we were asking about social media. Yeah, we know social media, apart from advertisement of other issues, it also advertises maybe products. We know like John Walker, we see is highly advertised.
Yes.
And then, and also peer pressure, as we are saying, this age group, there's a lot of peer pressure, is when you are trying to experiment, you want to look cool. And there are even songs that have been sung. Kulewa ni kuwa na marafiki, all that kind of thing. So you look cool, according to them.
Do you think it actually makes you guys look cool?
Yeah.
Does it? Does alcohol make a person cool? Or let's say drugs in general, not probably you, but about, your people, some of the friends who are with you. Is that their thought? Simama ukijibu.
Okay, I can say it depends with the perspective of the person. Someone else can say, like, for me, no. And someone else can say yes. It just depends with the perspective, actually. And the mindset of the person.
And the mindset of the person.
Yeah.
Dr. Caroline, I really did interrupt you there. So
so there's also a lot of social learning that we are saying. You see parents, because parents, I would say there's also a genetic predisposition. We see parents who use alcohol, and even siblings, they have a higher level of indulging, because it is genetical. There's some genetic predisposition. And then you have the psychosocial aspect, the one we're talking about. We know there's a lot of youth who do not have jobs, poverty, so all that, idleness. So you get yourself that you're engaging in that. For some people, it's a maladaptive way of coping with stress. So they think when you're stressed out, maybe alcohol is the best way to go, which is not a good stress management strategy. Some work, it depends on what type of work you do. Maybe working in a club, long hours, maybe pilots sometimes, depending. So they find themselves in that space, environment where you might start to indulge in this. So for you to understand the signs and symptoms of drug addiction, there's that urge of continuing to use it until it affects what you call your social, work, school, functioning. Where now, even at school, sometimes they start to see drop in your grades. Work, there's work performance, a reduction and productivity, a lot of autism, you know, sick of, depending whether at school or at work. Socially, you are not able to engage in small things that you're able to do because now you look unkempt. You know, some people who use alcohol, sometimes we just look at them, their physical appearance. They don't eat well, so they've lost weight sometimes. They're looking dehydrated because of poor feeding. Neatness, they are not as neat or as sharp as they used to be. Memory-wise, cognitive impairment, there's a lot of forgetfulness. There's a lot of poor decision-making. So the signs and symptoms, you start to see a lot of deterioration, even sleeping patterns, either poor sleeping patterns most of the time, and also bizarre behavior. Because we may say you start to, sometimes you find people who are using, let's say, marijuana, just laughing by themselves. And then you're asking, what is this guy? So there's some bizarre behavior you might also observe. Sometimes loneliness, because most of these drugs sometimes come with also a mental disorder. So sometimes you feel these people are looking isolated.
Yes.
They're no longer happy. They look sad. Or they're anxious. They're always on the edge. Some have even physical symptoms of tremors. They're holding a glass, but
they can't
really hold it. So you start to see some overt, we call them overt behaviors that you can easily observe. And then you can be able to understand maybe what is happening to this person. And then try to intervene. Yes.
And perhaps, how long does it take somebody to be addicted to a particular drug? How long does it take? Because there are people who have taken it for 20 years and they would tell you they're not addicted at all. So how long does it take?
At least 3 months and above for you to categorize that maybe this person could be slipping into addiction. Yes.
So 3 months of constant use every day?
Every day.
Okay.
Yes,
What is probably the effect? Sometimes someone just takes a little, maybe once a week, twice a week. Does that have an implication at the end?
It depends on what you're taking, because when you're looking at alcohol, let's say, alcohol is categorized. We have the whiskey, which the alcoholic content is about 40%. We have the beer, which is about 6%. We have the wine, which is about 12%. So it also depends on the amount of ethanol in that drink. Then, of course, when it comes to nicotine also, long term, we've seen in the long term, people get heart issues, chest issues. So you might be taking a little, but
it
at the end of it all,
actually
it will affect you in whichever way.
Thank you, Dr. Pauline. I'd love you to hold on that thought. And as we take a short commercial break, but we will be right back to indulge the youth, who will now tell us what is the most probably abused drug in their places of residence as well as their schools. Don't go too far. We'll be right back. Thank you for joining back. This is Body Garage on TV 47 as we shed light on drug abuse and drug addiction. And just before the break, we were talking about the most abused drugs as well as the signs and symptoms of addiction. And with us, we do have youth in studio. Probably now tell us, in your perspective, what is the most abused drug around yourself in your environment? Kindly do stand up and introduce yourself as you do the same.
My name is Salome. I can say, on my own perspective, it's alcohol, because many youths use it as a way of relieving their own stress, or relieving their own stress.
Relieving stress.
Yes.
So alcohol. Next, I'm waiting for a particular answer. Please stand up.
My name is Frank, and the most commonly used drugs in my area is bang.
Is bang.
Yeah. But sometimes nasikianga bang like it's a cure for a certain cancer. So some of the people in my area, they have that cancer and they use bang, but the youths kujibamba.
So some have cancer and are using bang to treat the cancer.
Those are the,
but some are preventing the cancer.
yeah,
happening.
And the youths kujibamba.
Anyone else who has something else? Please do stand up and introduce yourself.
I'm Ian. The most used drugs in my area is marijuana and then Mira.
Marijuana and then Mira.
Yes.
So let me just ask you, what is probably the cost, if you know, the cost of accessing these drugs? How cheap are they?
Like 50 bob.
50 shillings?
Yes.
Okay. So you hear that they're actually cheap as 50 shillings. And so we would probably want to ask now, for instance, bang, you've had the misconception that comes with that it cures cancer. What do you have to say first for that?
First of all, bang is an hallucinogen. According to the classifications of drug, it has a psychoactive reagent, THC. So for the treatment of cancer, I think in modern medicine, they've removed the psychoactive reagent so that it can be able to manage maybe cancer pain. And not only cancer pain, chronic pain actually is used for treatment of chronic pain, and also improves appetite, because you remember patients who are cancer because of the disease process, appetite sometimes, and treatment they go through makes their appetite to go down. So it is used to improve that. And it's also to treat other diseases, not only cancer. We have the chronic back pains, we have PTSD, according to statistics it has shown, and other areas. So that misconception that it treats cancer, yes, it is there. It is there, but without the psychoactive reagent that we call the THC.
Okay.
Because with that psychoactive reagent, then people get hallucinations. Because there's delusions and hallucinations when you use bang.
Okay.
Hallucinations, we are looking at mostly auditory and visual hallucinations. By that we mean you are seeing people I'm not able to see, or you are hearing voices that others
so by that
cannot.
Manisha, you've taken so much that you are actually seeing things.
Yes,
okay.
Yes, the psychoactive reagent you are talking about. Yes.
Okay, so perhaps now you can explain the concept of harm and reduction. This.
So harm reduction, the concept of harm reduction is aimed at reducing the negative consequences associated with drug use, that is overdose, prevention and safety. The goal is to save life and prevent infections like let's say HIV, because that's why we have programs like safe syringes and needles, because of the heroin, people who inject themselves with heroin. So we are when you look at that, we are preventing what we call infections and spread of infections, and mostly we are looking at HIV and hepatitis B, which is spread through blood. We also educating them on safe sex, because when you're on these drugs, yes, sometimes most of them engage in sexual activities that are not safe. So you might end up now getting the HIV and also the STIs, and also unwanted pregnancies, which I know most youth are afraid of pregnancy.
So they're actually afraid
of pregnancies than yes, contracting this disease. So there are areas where you could use, like, let's say, replacement therapy like nicotine. You could use the nicotine replacement therapy, or you could use the patch, you could use the gums, or you could use the spray. For the heroin users, there's the methadone clinic, which are run in the country, that will reduce that harm of injection. And of course other infections that we are looking at large. So it's just reducing the effects of drug use. That is what we call the harm reduction strategies.
Okay.
Yes.
So you are a counseling psychologist.
Yes.
Perhaps how has drug abuse affected families?
Yeah. So when we come to drugs and alcohol use, it does not only affect the individual. Remember, this individual stays in a family, and then the family, we have the society and the communities at large. So this one person, if we are not able to support them, and of course the influence, the large influence at large, like now, I would give an example, like what is happening in the country. There are communities that they have got indulged in this as vice that has made them just not productive at all. And we are supposed to be productive, even at our family level, doing something and engaging in our social work or whatever aspect of life that we can be able to do. So when a community or a whole society or a family member, the other people feel burdened because now these responsibilities, you are a father, you are not able to take care of your children, so you'll overburden the other people. And even the cost of treatment at large as a country, when it comes to treatment in terms of complications or these drug diseases effects, then it becomes a burden, even a health burden to the country at large. So it spills from the individual to the family, community, and the country at large. It has that ripple effect.
Okay.
So if you're able to prevent,
then
it becomes,
it
becomes better.
Okay.
Yes.
And so let's go back to now the addiction. Someone is addicted. How much would it cost somebody to, be treated? Now, let's enroll them into a rehabilitation center. What are the economic costs?
So most rehabilitation centers, I would say rehabilitation center is just like whatever, let's say, hospital you choose to go to. But most rehabilitation centers, I think they take in like at least 3-month stay, and it's not less than 90,000, depending on for the 3 months.
Okay.
Yes. Not less than 90,000. Yes.
Okay.
Yes.
And so now, what about the stigma that comes with now accepting that I am addicted, and now you want to seek for help, and so someone is facing social stigma for it? How do you advise to your clients or anyone going through that to? So
what we say, even as a society, we start with the language.
Okay.
Instead of saying the drug users, we say people using drugs.
Yes.
There's a language you would use. So that makes you look compassionate about even how you start. The how matters.
Yes.
So when you address people in a good way and be compassionate, it is the beginning. And also this person has to accept. It starts with the acceptance that I think I'm going through this and this, and I need help. So when we look at that in terms of approaches on how to assist the patient, this has to be acceptance. Have insight that you have a problem. We call it insight. Somebody might tell you, I think you have a problem with alcohol or drug, but unless you have insight and understand that I have a problem, even if you take you to the rehab for the 3 months, even if you pray for you, even
you
if
still want
you still, so until you understand that you really need to change and there's need for behavior change, that is when the conversation becomes meaningful.
Okay.
So we encourage, I think, in terms of successful approaches, maybe we'll talk about that when we get there.
Okay. Let's engage. Let's talk about now addiction. How do you deal with perhaps your friend who comes and tells you, I think now this is becoming a problem? What would be your first instinct? How would you want to help them? The lady at the back.
To advise them to go to the rehabilitation center, because I think that's the best thing to advise someone first. And secondly, put God first.
Put God first.
Yeah.
Because God before
everything.
Yeah.
Thank you.
Okay. Has any one of you probably had an interaction with anyone who was beginning to slip into addiction? Nobody. You've not seen even the effects. What are some of the effects of, you know, how has drug abuse affected somebody near you, close to you? Well, as you think about it, let's talk about the approaches now that are used in treatment of drug addiction.
So when it comes to the approaches, we have like the 5 A's where we ask about, you have to inquire about addiction.
Okay.
Because we should not assume. Like when you get a client, you have to ask. You have to ask about the addiction.
Okay.
Then advise, assess, assist, and arrange for follow-up. So during this process, there's a stage where we call transformational stages of change, where a client could be in the pre-contemplation stage. They're still thinking whether they need to change or not. But then they slip into what we call contemplation stage, where they've made a decision.
Okay.
I think I need to change in terms of behavior. Then we prepare them in terms of, we call preparation. Preparation, it's like planning. What plans or what modalities are we going to engage? And then we go into what we call the action phase. That is in terms of practical issues on how you need to deal with it. The practical issues, we are looking at what we call the action. We are looking at what are the triggers, what is maintaining this behavior, and what are the protective factors in terms of support. What support mechanism do you have around? Because these clients need a lot of support, emotional support, for them to overcome. Then we look at maintenance. Are you able to quit? Once you've quit, are you able to maintain this state of